Tufan, do you find that sometimes patients in your practice are a little reticent to undergo the procedure? I mean, how do you best prepare them to undergo a urodynamics? How do you reassure them about what they're going to experience, and what type of education do they get before the procedure?
Yeah, thank you, Melissa. This is also a very important point. I think it's a myth that patients do not like to undergo urodynamic studies because of the invasiveness. We are currently performing ongoing studies about the mood of the patients, how they really receive the urodynamic studies, and we have also published it, actually presented it, in one of the ICS meetings. So the important thing is patient counseling here. If you just inform the patient thoroughly about the steps of the procedure, and just informing the patient that it is a painless situation, a painless test actually, and inform how the catheterization is being performed, and why you are doing the urodynamic study. This is very important. You have to explain to the patient why urodynamic study is needed and what kind of a change that will make in her treatment. Then our feedback from our patients are very good. So I can frankly say that we didn't have even one patient who was unhappy with the invasive urodynamic study. So it's very important to prepare the patients before the urodynamic study about the steps, about the objective of the study. You can use also written materials or visual materials to teach them better about the urodynamic study. What is your policy here?
Yeah, let me echo some of the same points that you've brought up, is that when I counsel patients, I let them know that in general, it is exceptionally well-tolerated study, that it requires no anesthesia and has very minimal and transient risks. I do walk them through, as you do, exactly what the steps are going to be so there's no surprises. And I actually tell them that. Say, I don't care for surprises, and I bet you don't either. So this is what's going to happen when you come for this study. I give them an expectation of the time, and I'll let them know that at the conclusion, at least in my practice, we sit down together and we come up with their treatment plan that very day. And so that is important because now we have some meaningful data in order to drive these types of solutions. I also have provided written material, which is widely available from ICS and SUFU, that at the time of the scheduling, because it's very important that the patient have something they can take home and review and look at, and it gives them access to also, as they do their own investigation regarding the study. There are some very common questions regarding their studies, including just the simple time that it's going to take for this to occur and for the clinic visit. And do they need to not eat or drink before the study? Right. So we need to demystify some of the simplistic parts, and it can save your clinic staff a good deal of time. And then the patient is comforted in knowing that how well tolerated the procedure actually is, and that this is all clinic based with very minimal risk.